Why root canals are not fearful dental procedures. A D.D.S., Doctor of Dental Surgery, performs root canals to avoid extracting an infected tooth. The tooth, much like our skin or bones, has several layers. The innermost layer of a tooth, the pulp, has blood and nerve endings. When the tooth develops cavities, the gaping hole acts as an entry point for bacteria, exposing the pulp to infection. Depending on the manifestation, you'll get a diagnosis of cavities or periodontal disease or gum disease. If damage to the pulp is too extensive, dental hygienists often recommend a root canal procedure. What happens when you have root canal procedures? Root canals have horror stories attached to them, yet, interestingly, it is in reality a painless procedure. Why are there all those stories of excruciating pain flying around? The first signs of trouble in a tooth start with understated warnings. You may start to feel pain when chewing or sense a dull ache when you clamp your teeth tightly. Many people ignore these signs. At the next level, the tooth becomes extra sensitive to heat or cold. This is another warning that many people ignore. The third glaring warning is when the gums start to swell, become red and tender, and hurt. Again, many people ignore this warning sign. Most people ignore the signs because they're ignorant of the impending results. All signs that come with pain and toothache are warnings from your body saying something needs dental work. If you take the warnings seriously, an early visit to the dentist may reveal that your pulp is already worn out. They then may recommend a root canal. At that point, root canals are painless. Root canals leave the tooth sterile. Dentists recommend root canals as an alternative to removing the entire tooth from the root. The procedure, therefore, maintains the tooth in place, but without the ability to feel pain. That way, you retain your wisdom teeth, molars, cuspids, or bicuspids, even though you did have an infection. However, this is particularly dangerous. Pain is the body's alarm bell. To ensure the dead tooth does not serve as an entry point for harmful bacteria, the dental hygienist makes the tooth sterile and impenetrable with fillings and crowns. To carry out the entire procedure, the first step is to numb the mouth. The dentist will then drill the enamel to get to the pulp. The patient is under local anesthesia, and they are aware of what is going on at all times. A dentist will keep seeking feedback to ensure the patient is not experiencing any pain. In the first appointment, the dental hygienist will remove the pulp and cover the hole with a temporary filling, and they'll prescribe medication to prevent infection. The final tally. So are all the stories of excruciating pain myths or hype? No, they're not. Most people put off going to see their hygienists for too long. When they eventually get to have the dental work done, the infection is very severe. In such a case, the procedure may be extremely painful. The way to ensure your procedure is not painful is to seek medical help at the earliest.